Low testosterone or hypogonadism symptoms, causes, and treatment. Low testosterone, also known as hypogonadism, is a condition in which the testes, in men, or the ovaries, in women, do not produce sufficient levels of the hormone testosterone. Testosterone is a critical hormone that plays a central role in various aspects of health and well-being, including sexual function, energy levels, mood, and muscle and bone mass. In men, it is primarily produced in the testes, while in women, it is produced in smaller amounts in the ovaries and adrenal glands. This comprehensive guide will provide an in-depth understanding of low testosterone, covering its symptoms, causes, and treatment options. Symptoms of low testosterone. The symptoms of low testosterone can manifest differently in men and women. In men, the symptoms may include reduced libido, sex drive. A decrease in sexual desire and interest in sexual activity is one of the most common symptoms of low testosterone in men. They may find it more challenging to become aroused and may have fewer sexual fantasies. Erectile dysfunction. Low testosterone can contribute to erectile dysfunction, a condition in which men have difficulty achieving or maintaining an erection sufficient for sexual activity. Fatigue. Individuals with low testosterone often report feeling tired, having low energy levels, and experiencing a general sense of fatigue. They may lack motivation for physical activities or even daily tasks. Depressed mood. Changes in mood and emotional well-being can occur. Men with low testosterone may experience increased irritability, mood swings, and even symptoms of depression. Reduced muscle mass and strength. Testosterone plays a vital role in the development and maintenance of muscle mass. Low testosterone can lead to a decrease in muscle mass and strength. Increased body fat. Low testosterone is often associated with an increase in body fat, particularly in the abdominal area. This can contribute to weight gain and obesity. Sleep disturbances. Some men with low testosterone may experience disturbances in their sleep patterns. This can include difficulties falling asleep, staying asleep, or experiencing restorative sleep. Cognitive changes. Cognitive functions, such as concentration and memory, may be affected in some individuals with low testosterone. Decreased bone density. Low testosterone can lead to a reduction in bone density, increasing the risk of osteoporosis and fractures. Hair loss. A decrease in body and facial hair may occur in some cases. Hot flashes. Some men may experience hot flashes or night sweats. In women, low testosterone can cause symptoms such as irregular menstrual cycles. Women with low testosterone may experience irregular or absent menstrual periods. This is often associated with other hormonal imbalances. Reduced libido. A decrease in sexual desire and arousal can occur. Mood changes. Low testosterone in women can lead to mood swings, depression, and anxiety. It's important to note that the severity and presence of these symptoms can vary from person to person, and some individuals may experience only a few of these symptoms, while others may experience several. Causes of low testosterone. The causes of low testosterone can be classified into two categories: primary hypogonadism and secondary hypogonadism. Primary hypogonadism. This occurs when there is a problem within the testes themselves, leading to inadequate testosterone production. Common causes of primary hypogonadism include testicular injury. Physical trauma, such as a severe injury to the testicles, can damage the testes and impair their ability to produce testosterone. Infections. Infections such as mumps can affect the testes and lead to inflammation and damage. Radiation and chemotherapy. Cancer treatments, such as radiation therapy and chemotherapy, can damage the testes and disrupt testosterone production. Genetic conditions. Certain genetic conditions, such as Klinefelter syndrome, can result in abnormal testicular development and function. Undescended testicles. In some cases, testicles do not descend into the scrotum during fetal development. Surgical correction is often required to place the testicles in the scrotum, but low testosterone may still result. Secondary hypogonadism. This form of hypogonadism is due to a problem with the pituitary gland or hypothalamus, which regulate the function of the testes. Causes of secondary hypogonadism include pituitary disorders. Tumors, infections, or other conditions affecting the pituitary gland can disrupt the secretion of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, which stimulate the testes to produce testosterone. Head trauma. Head injuries or trauma can damage the pituitary gland or hypothalamus, interfering with the release of hormones involved in testosterone production. Medications. Some medications, including opioids and corticosteroids, can suppress the hypothalamic pituitary gonadal axis, leading to reduced testosterone production. Obesity. Excess body fat, particularly in the abdomen, can lead to insulin resistance and increased conversion of testosterone into estradiol, a form of estrogen. This process can result in lower testosterone levels. Aging. Testosterone levels naturally decline with age, typically starting in the late 20s or early 30s. This age-related decline is often referred to as late-onset hypogonadism or andropause in men. Chronic illness. Certain chronic conditions, such as chronic kidney disease, liver disease, and HIV/AIDS, can impact the endocrine system and lead to low testosterone. Use of anabolic steroids. The use of anabolic steroids for bodybuilding or performance enhancement can suppress natural testosterone production. Excessive alcohol consumption. Chronic, heavy alcohol use can disrupt hormonal balance and lead to low testosterone. Treatment options for low testosterone. The treatment of low testosterone depends on the underlying cause, the severity of symptoms, and the individual's specific needs. Treatment options may include testosterone replacement therapy, TRT. TRT is the most common and effective treatment for low testosterone. It involves the administration of exogenous, external, testosterone to raise testosterone levels to a normal range. TRT can be administered through various methods, including injections, gels, patches, nasal sprays, and implants. Lifestyle changes. In some cases, making healthy lifestyle changes can help raise testosterone levels naturally. These changes include regular exercise. Physical activity, especially resistance training, can boost testosterone levels. Weight management. Achieving and maintaining a healthy weight can help reduce the conversion of testosterone into estrogen. Balanced diet. Consuming a diet rich in nutrients like zinc, vitamin D, and healthy fats can support testosterone production. Management of underlying conditions. If low testosterone is secondary to an underlying medical condition, such as obesity, diabetes, chronic illness, managing that condition can help improve testosterone levels. Clomiphene citrate. Clomiphene citrate is a medication that can stimulate the body's own production of testosterone. It is sometimes used in men with secondary hypogonadism. Human chorionic gonadotropin, HCG. HCG is a hormone that can stimulate the testes to produce more testosterone. It is sometimes used in combination with other treatments, especially in younger men who wish to preserve fertility. Counseling and support. Mental health support, such as counseling or therapy, may be recommended to address any emotional or psychological issues associated with low testosterone, especially in cases where mood changes are prominent. Monitoring and adjustment. Regardless of the treatment chosen, regular medical monitoring is essential to ensure its safety and effectiveness. Dosing and treatment options may need to be adjusted based on individual responses. It's important to note that the choice of treatment should be made in consultation with a healthcare provider. The appropriate approach may vary based on individual circumstances, age, overall health, and personal preferences. Safety and considerations. Testosterone therapy is generally safe when administered under medical supervision. However, it may not be suitable for individuals with a history of prostate cancer, certain heart conditions, or those seeking fertility preservation. It is essential to discuss the risks and benefits with a healthcare provider before initiating testosterone therapy. TRT is not approved for use in women, except in certain medical conditions where testosterone deficiency is present. In summary, low testosterone, or hypogonadism, can have significant effects on an individual's physical, emotional, and sexual well-being. Recognizing the symptoms and addressing them through appropriate treatment options can lead to improved quality of life. Seeking medical advice and guidance is crucial for the accurate diagnosis and effective management of low testosterone. Thanks for watching. Subscribe for more video like this.